After any injury to our body, we seek the help our body needs to recover well. So when our brain suffers an injury, why not give it the help it requires in the form of neuropsychological rehabilitation?
So how do we understand neuropsychological rehabilitation? Let's look at the example of a brain stroke. Unfortunately, a lot of us would know or would have heard of people undergoing physiotherapy after suffering a brain stroke, either because of imbalance or for loss of strength in their arms and their legs. We know that a stroke occurs in the brain, but do we know what happens with the other functions of the brain? So what are the main functions? Memory, attention, language, being able to learn new things, being able to plan your day, even your whole personality, your mood, how angry you get or how interested you are in conversations with people around you. All of these are functions of the brain. So when we think of a brain injury, we cannot assume that these will not be affected. These functions and these injuries are unfortunately invisible. But when we can't walk or people have difficulty staying balanced, those are visible injuries, and hence people associate physiotherapy and are more aware of physiotherapy as treatment after a brain stroke. But what is crucial for us to understand is that the quality of our life is very closely affected by neuropsychological functions, and therefore neuropsychological rehabilitation is very important to include in the treatment plan after somebody has a stroke or any other form of a brain injury.
So just to summarize, if anybody you know has had a stroke or a brain injury, they might need neuropsychological rehabilitation to deal with the invisible symptoms such as loss of interest in hobbies, misplacing everyday items, being constantly distracted or absent-minded, suddenly becoming withdrawn from socializing, repeating themselves frequently, being confused while planning their day, any sort of difficulty communicating, and most importantly, a sudden change in personality.